So a new global health emergency has just been declared. And this is because a new spread of a virus is now going around. Now, this is a newer variant. I want to address what's going on. No, this is not COVID. I will address this in just a moment. I've talked about this already this week, but this is something that many people are extremely worried about. And here in the United States, we should be a little bit concerned about this as well. So I'm going to break all this down in just a moment, but all I ask is one thing. It takes 2 seconds. Go ahead, hit that like button if you enjoyed these daily updates. And now, let's begin. So, oh great, we have another global health emergency. But what is this from? Well, let's discuss this. The World Health Organization just today declares Mpox outbreaks in Africa a global health emergency as a new form of the virus spreads. Yes, Mpox is now starting to mutate. It is now turning into a huge concern. Just look at this. Why is this happening now? Well, look at this. It says there are a few reasons. An assistant professor in Emory University's infectious disease department tells Yahoo Life more than 14,000 cases of Mpox have been reported in the DRC so far this year, exceeding the total for all of 2023. And at least 524 people have died there, 240 of them children. Says the infection is 4 times more fatal for kids under 15 than it is for adults. Okay, that's a huge concern. But let's get into what they're really talking about. It says that the guy says it's not clear why the disease has become so deadly to children, but the prime suspect is a variation or a subclade of the virus that has branched off and developed mutations that make it better at spreading between people. This is part of the concern, that it makes it easier for it to mutate and spread amongst people. It spreads amongst animals and from animals to human. Now it's easier to go from human to human. And what's going on right now? Well, we are seeing a massive amount of immigration here into the United States. People are traveling abroad. They're coming into the United States, sneaking through the border. So if somebody comes from Congo or South African country or area, the issue is they could be coming into the United States already infected with Mpox. They may not know it, and we wouldn't know it either. Let's keep reading this. It says the new subclade may also be fueling the virus's spread across borders to other countries within the African continent, including Burundi, the Central African Republic, Kenya, and Rwanda, that led to Africa Centers for Disease Control and Prevention to declare a continent-wide public health emergency just yesterday on August 13th. Says so far, however, no cases of the new subclade have been identified outside of the African subregion, according to the person's notes. Now, here's where things are interesting. We're already getting reports here in the United States, and I want to show you this. This is a map, according to Newsweek. This is a map that shows Mpox's virus detection in wastewater. This is between July 10th and August 6th. I want to show you this really quick. Okay, look at this right here. So this is the map. Now, in red, this is the consistent detection. It's over 80% of samples tested positive in the most recent detection in the last 2 weeks. And then intermittent detection, this means 1 to 80% of samples are tested positive. Most recent detection in the last 2 weeks. Blue is no detection, but they have tested samples. And then in gray is insufficient data. Okay, there's very few samples. Now, there's no red. Okay, let's just be very clear. I don't want to spread any false rumors or reports. There's no red. Okay, so it means we are not seeing samples over 80%. That's good news right there. We are, however, seeing some samples, in certain areas. Now, this is why it's a concern. Look at the areas. Look at the 3 dots. Okay, so right here, this is in San Diego, California. The population served 22 million or 2,200,000, I believe. 9 samples collected. Out of 9 samples, 1 was positive. over here in Los Angeles, okay, or San Francisco, wherever we're at. Where is it at? Somewhere over there. Anyway, you get the idea. Over here in the San Francisco area, there is a detection, and then over here in Chicago, okay, 3 samples collected, 1 was positive. What do these areas, San Diego, San Francisco, or where is it at? I just had it. I missed it. Anyway, somewhere over there, in the San Francisco area, and then in Chicago, what do those areas have in common? And keep in mind what's here. Okay, this is Colorado. What's interesting though, okay, what's very interesting about Colorado is there's no testing. Okay, there's no testing in Colorado, but where are most immigrants going? Going to California, going to Colorado, to going to Illinois or the Chicago area. Well, what's interesting is that those areas are the ones that are seeing the highest detection. Is there a reason why? Is it because people are coming in from other countries? Most likely. Okay? Now, the reason why I'm bringing this to your attention now is because we're already getting some people discussing a potential shot. What do you need to do? And I'm just going to be very honest with you. That's the first thing the CDC says. How do you prevent this Mpox from spreading? Well, step number 1. There it is. Okay? Now again, whether you go and get it or not, it's none of my business. But I want to show you how it spreads. I think that's the most important thing. Look at this right here. How it spreads. It says there are 2 types of Mpox, clade 1 and clade 2. Both clades can spread through direct contact with infected wild animals, through close contact, including intimate or sexual contact with a person with Mpox, and through contact with contaminated materials. So all it takes is contact with a person, an animal, or materials. Right? Touch a doorknob. Okay, use the same car keys. Someone has it and they hand you their phone. That's all it takes. Okay? It says close or intimate contact, right? Touching objects, infected animals. This is how it spreads. Now, what does this mean for us moving forward? Well, the concern is it is going to spread. That's the concern, is that we are anticipating it is going to spread. Now, how much will it spread and when will they actually declare an outbreak here in the United States? Well, look at this. It says so far, 1,122 cases of clade 2 Mpox have been reported in the United States this year. So in the past 8 months, we have seen 1,122 cases. Okay. It says most new cases have been reported in people in higher risk groups who have not received 2 doses of the Mpox vaccine. This is according to the CDC. Now, here's the concern. If people have Mpox or they're worried that somebody might have it, do you think anybody says something? At this point, no. The cases that have been detected, have been reported, are most likely people going into a doctor, being seen. Okay? So this is likely children. This is likely older people. Okay? The elderly people. These are usually the 2 groups that are at higher risk. Now, does that mean this is not a risk? No, it does not. Is Mpox a serious risk? Could we see this deadly virus spread and turn into the next pandemic? Potentially. Do I think it's going to? I don't. But at the same time, just be aware it's there. Be aware that we are going to see more and more people discuss it. If we are coming up on a presidential election, this is a massive election. We got our current President Joe Biden, is not going to run. That means it will be a new president, a new administration. Right now, it will either be the Harris administration with her running mate, or it will be the Trump administration. We're going to find out soon enough who's going to be the next president of the United States and what this means for everyone moving forward. But as of today, that is what we know. So again, thank you guys for watching. Consider subscribing, and I'll see you guys on the next one.